Hey everybody, Dr. Sean Casey here from Healthcare Complete Back and Neck Pain Center. We're answering a lot of questions that come across our desk, and there's a big one I want to discuss today that's super important. It's actually identifying the core cause of your illness. Now, in a lot of cases, we focus on the symptoms. You know, I've got a headache, I've got the sniffles, I've got a stomach issue, and I get it. The first thing we want to do really is get rid of those symptoms and feel better. The key to that, though, is finding out what the core cause of the problem is. You know, there's an old joke in the chiropractic industry. It's like, I have to ask you a question. Do you think that your headache is due to a lack of aspirin? Or you have this giant Tylenol bottle in your body that's emptied out, you need to refill it? Well, of course not. But in a lot of cases, we think that's the cure. Typically, it's a great way to symptomatically treat an issue, but it's not going after the core cause. In a lot of cases, headaches, for example, we'll find that maybe there's a decrease in your nutrition causing those headaches, causing cramping and muscle spasms. Maybe it's due to dehydration. In a lot of cases, it's due to the bones in the neck being out of alignment, irritating the nerves to control blood flow and sensation to the scalp, or cause the muscles to contract to stabilize so they don't go further out of place, and then cause those headaches as well. There's a lot of issues we see today that folks are dealing with, which is really sad. We look at heart disease, we look at diabetes. We know these aren't just things that pop up. We know there's a lot related to nutrition. There's a lot related to some genetic factors, but also a lot of it boils down to paying attention, finding out, finding the core cause. So, regular checkups we know are the key thing. We found this about cardiovascular health. For years, the first symptom someone ever had of heart disease was they dropped dead of a heart attack. And that was very, very common. Nowadays, we're paying attention to pulse rate, blood pressure, getting checkups, getting blood tests to analyze that to find out before it gets worse. Looking at family history, what mom, dad, grandma, and grandpa have, what they have to deal with. Some of it is purely due to diet. We know today that a lot of our choices in the past for food has caused tons of damage to our body. So we know that if we actually make those better choices, we're going to stop putting things that cause inflammation and damage to the heart, lung, liver, to our immune system. And we found out that, hey, if I eat a little bit better, i.e. drop the sugar, drop the inflammatory foods, my allergies are better. I'm not getting as sick. My stomach feels better. And you know you've done this before. Sometimes you decide to lose the weight before vacation, you cut out sugar, you cut out starchy foods, and all of a sudden, not only did you lose some of that weight, but you didn't have that indigestion. You didn't have that bloaty feeling. And you know if we're having indigestion and bloating, that's not just a symptom. That means something's specifically not working properly. We know, for example, type 2 diabetes, it doesn't come out of the blue. You've been eating the wrong things for a long period of time, and it's chemically destroyed your body. As a matter of fact, when we talk to patients about nutrition and health, we always talk about what's called the anti-inflammatory diet. For the past several years, we'll see different books about the Mediterranean and South Beach diets. It's all kind of the same thing. Certain foods we eat create inflammation. Why is that a big deal? Well, you hear your pH is off, you're inflamed, you're too acidic, kind of the same thing. Long-term research studies have shown time and again, we're trying to find out what's the cause of cancer, heart disease, diabetes. It always comes back to, it's inflammation. You've had this chemical wear and tear damaging the cells and the tissues of your body for 10, 20, 30, 40, 50 years. And your body will do a great job of dealing with stuff until it can't. And that long-term damage is kind of caught up to you. So, little things like watching what you're putting in your body, making sure you're getting those checkups, get those screenings, and maintaining your health with good checkups, chiropractic care to make sure the mechanics and the nervous system work properly can go a long way to preventing long-term diseases. Just because they're common doesn't mean it's normal. Doesn't mean we're supposed to get this stuff. It just happens too much because we're not doing enough of the right things. The great thing is, we're a lot smarter now, we're a lot better. We just have to take advantage of that knowledge and use it for ourselves and for our family's health. Well, I hope this helps out. If you have any specific questions on this, please give us a call. We'd be happy to help. Have a great day.